Hi, my name is Dr. Aaron Doe. If you're watching this, it's probably because you've been told that you had a cataract, and you're here today for us to take a look at that and see if there's things we can do to help you out. Before we get to see each other, I'd like you to know some things about cataracts. It'll make our discussion a lot more fruitful. A cataract means that your natural lens inside your eye is getting cloudy. People that have this, they'll start to notice that they have more trouble seeing street signs. They'll certainly have more trouble driving at night. Glare from lights will bother them. Also, they may find that when they're in low light situations, in the rain and the fog, their ability to distinguish things, their contrast sensitivity gets a lot lower. The time to do something about a cataract is when it starts getting in the way of you doing things that you want to do. If you find that you need to drive at night and it's not safe anymore, that's a good reason for doing cataract surgery. If you find that you're having a hard time reading, seeing the computer, doing the outside activities you like doing, these are all good reasons for having cataract surgery. Cataract surgery itself is done at an outpatient surgery center. You're usually there for about 2 or 3 hours. The surgery itself, though, only takes about 10 minutes. We usually do just one eye, and if your second eye needs it, that's usually done 1 or 2 weeks later. During the procedure, you'll have drops on your eye so you can't feel what is happening, but you'll also get medicine and IV, and you really won't care what's going on. In fact, many of my patients tell me they can't even remember the procedure itself. You get to go home after the surgery. Usually, there's no stitches placed in the eye, and we usually just put a clear shield over the eye and people can start seeing right away. We will need to see you the next day to check on you. Most people, their vision is often blurry for the first few days, and that's a normal part of the healing process. Activity-wise, for the first week, I ask people not to do anything that makes them squeeze their eye or rub their eye. I don't want people going to a gym or picking up real heavy weights where they have to squeeze their eye or going swimming. But outside that, you can do most things. It's okay to bathe normally the next day after cataract surgery. It's okay to start using your computer, your iPad, or look at your cell phone as soon as you feel comfortable. Most people will take off the next day from work, but you actually don't have to if you don't want to. You can start driving as soon as you feel comfortable to drive, but you want to wait at least 24 hours so that you get used to the new vision in that eye. This surgery is very safe as medical procedures go, but there is a risk involved with cataract surgery. There's a small risk of bleeding or an infection or getting a retinal detachment. Sometimes I can't get all the lens out, or sometimes I can't get a new lens back where it needs to go. And occasionally, patients need to have a second surgery to get everything exactly where we need it to be. Fortunately, that doesn't happen very often. If you take all patients put together, about 97% of people will have much better vision once they've healed from cataract surgery. About 2% of patients, they won't get much better, and that's oftentimes because there's things inside the eye that we could not tell because the cataract was obscuring our view of the back of the eye. And unfortunately, about 1% of patients that have cataract surgery, they will get worse than where they started, and there's nothing we can do to fix those folks. So it's important when you think about cataract surgery to weigh the risks and the benefits. People that have cataracts do not have to have them removed, but if they want to see better and they're willing to accept that small risk, then for most patients, this is a really good procedure for them. When you do the cataract surgery, you're going to have a lot of really neat options about the lenses that go inside your eye. One of the neat things that's happening now is there's some advanced lenses that can help a lot of people see without glasses. Insurance companies all pay for a basic lens that goes inside your eye. These lenses work great, but usually they require glasses for patients to see their very best. There are some lenses out there now that help patients not need glasses for many of the tasks that they do. I want to tell you a little bit about those lens options because this is a choice that you may get to make. It's great these days that both Medicare and insurance companies, although they cover a basic lens that go in cataract surgery, they allow folks to upgrade their lens in order to get results so that they can see more clearly without glasses than they would with the basic lens. As part of our evaluation, we're going to do a lot of different scans, and we're going to make sure that if you choose one of these options, that we can find a lens that would fit and would give you the results that you're looking for. They really come in 3 different varieties the lenses do. The basic lens, which I've talked about, which works very well but requires glasses. The second lens option is they make lenses that have astigmatism correction built into them. These lenses let people see very well at distance. In fact, these lenses, when used in the right candidates, have about an 85% chance of letting people pass their driver's test without glasses, which is really an amazing thing if you think about it. But people that have these lenses will still need glasses to read with and to see the computer. But for their outdoor activities and driving, they do very well. One of the newest advances in cataract surgery, which I'm really excited about, is that for patients that have astigmatism, we can now digitally map that astigmatism in our clinic, and we can take that same image and we can overlay it on the eye during the surgical procedure, which allows us to digitally line up the lens inside the eye and to maximize our ability to correct astigmatism. One of the other neat things that this piece of technology does is it also maps out where the center of your vision is. People oftentimes assume that the center of the vision is the center portion of their pupil or their eye, but actually, for most people, it's not there. It's off a little to one side or the other. With this technology, we can now map that, and when we put the lenses in, we can center the lenses based on the preoperative measurements, so when you're undergoing surgery, we don't need your help. We know where the lens is supposed to go before we ever start. Finally, the third category of lens is the multifocal lens. Most patients that have this type of lens can do most tasks without the need of glasses. These lenses really ought to be called bifocal lenses because they have 2 focal points, one focal point at distance, and the second focal point we get to choose. And that's why it's going to be important that we kind of talk and make sure that this focal point is the one you want. They have these bifocal lenses that work distance and sort of a mid-range, and then they have ones that work at distance and up close. So we want to make sure we maximize whether you're more of a person that's using a computer or more of a person that does a lot of fine up-close work. For many patients, we can actually mix them a little bit, and we'll put one in one eye that has distance and mid-range, and the other eye will oftentimes put one that has a distance and up-close range to give them kind of the best of all worlds. You need to know that some of the multifocals will give people a little higher risk of seeing rings and halos around lights at nighttime. There are certain multifocals that have somewhere around a 5 to 6% chance of you seeing rings at nighttime that can interfere with your driving. So it's important if you do a lot of nighttime driving that we make sure we choose a multifocal that will minimize the risks of having that. It may take days to months to get used to your multifocal lenses, but given some time, 95% of patients are very happy with the outcome they get from these lenses. Thanks for watching this video. I look forward to seeing you and answering your questions that you might have about cataract surgery.